This is at least 20 minutes since the prior filming, and during the course of treatment to try to gain pelvic mobility, she spontaneously commented that breathing felt easier. And I'm pleased with the gain in mobility that we achieved on that right ischium. I can see both heels bob medially, so the force goes through that. And here is a anterior force going through that hemipelvis. Walk across the street, the same thing. It can get force transmission through that structure, whereas before I could not. And when I do this, I immediately see the heel bob up and down. I take at the slack, go to a stop point, and then I induce the force. And yes, I appreciate my arm's at an angle, but I direct the direction of the force is quite specific. And here's loading through the sacrum. And I don't call this necessarily sacroiliac mobility, but I call it restoring movement, functional movement, force transmission through the pelvic structure. And this is what we found at her rib cage. I can now get some force transmission through that structure. And then you made a comment when you were walking. And what did you, before I even asked that question, not sure I caught this on film, but we very easily gave you more hip extension on both sides. But can you tell us there's a little bit of give up there in the pelvis. We want to focus on the hip. That's certainly 10 degrees. So how did you feel when you just walked a moment ago?
Well, it felt much easier. I felt like I was gliding rather than pushing through resistance when I walk.
Nice, nice. Still some asymmetry in your gait, and so I don't want to film it right now. I want to work with you a little bit more and see if maybe you need more of a lift on one side. Your legs might be completely even, but the fact that your hemipelvis is different side to side, that may actually require you to have a lift, when you're walking. And also when you're sitting, you might need some propping so that the chair doesn't try to force you in symmetry when developmentally your pelvis is asymmetrical. So I'll stop filming here, and we'll see what we can learn, and might do one more film later on today.